Marquand's introduction there. But what I'll say is that the survey instrument that we put together was 52 items. We tried to keep it brief to around 15 minutes for respondents to answer. The majority of questions were taken from a study that Jeff Morinoff here at the university was already conducting called the Detroit Metro Area Communities Study. They had put together a coronavirus rapid response survey. So a lot of the questions we pulled for this study were taken from that. So the questions concern things like housing arrangements in the midst of the pandemic, how seriously individuals took the COVID-19 pandemic, their preventative behaviors that they've observed during the pandemic, the economic impact of the pandemic itself. Additional items that we added following a previous community conversation we had back in June had to do with support for wearing masks, people's willingness to take an eventual vaccine for the novel coronavirus, and overall internet access. Another thing I'll say is that we were conducting the survey in the midst of sort of a tumultuous time, certainly around the community's relationship to institutions and to law enforcement in particular. So we felt the data collection was a good opportunity to ask additional questions around people's attitudes towards their elected representatives, around the seriousness with which they were taking COVID-19 in their communities, and also perceptions around law enforcement in the community and how much they felt that law enforcement cared about individuals like themselves. And I'm happy to sort of discuss results related to that, but once we got, I should say the period of data collection was from between around June 12th to about August 21st over the summer. And once we obtained the results, we then had a conversation about how to present those. And as Marquand was alluding to earlier, Jan Nazaro was involved with sort of pulling together a graphic to display our results. And I don't want to put Jan on the spot, but maybe you can discuss sort of the process you went through in putting together a graphic that is available online that our web team put together.
Sure thing. Hi, everyone. I'm Yana Zaro, and this project really came together with just so many people collaborating at the same time, so I'm really grateful for that. Commercially, I am a graphic recorder, and so that's typically an illustrator that draws on the spot. I had the weight and the privilege of having more time with this information. So of course, these data points can be really striking and disheartening. And I really wanted to strike a tone of, when I typically draw on a large piece of paper in front of an audience, to really making it a very personalized experience. So I'm taking iconography or drawings that might first come to mind and adapting them a little bit and thinking about how they communicate to our residents and our community. And the methods in which I did that was really through finding simplified icons, but also adding some levity to a very, very serious topic. So when we're talking about, let's say, the percentage of people that have lost a loved one or someone that they know, you know, the question of whether or not we should use a gravestone came up. And I think that in the style that I work in, it does bring some levity to it, even though we are looking at difficult information. So this has really been a process of collaborating with lots of folks. So I really thank Robert, Trina, Lisa, and Nikki for making this come together quickly. Not only were we able to get this out into the form of a mailer, which the county will put out, thanks to Elise Asbury Payne, but also communicating it out to the actual residents, which this affected and who actually took the survey. So thanks to Marquand and Patrick for taking that and making sure that the people that are surveyed upon actually receive the information back. And hopefully my illustrations make it aesthetically interesting, that they want to take a deeper dive into it. When you get into the PDF, you can actually click onto links, which Patrick was able to find. And I think that this is an invaluable way for people to really think about, how does this affect me and how does this affect my neighbor? And wow, we're actually seeing these numbers in 4819798. So it's been a very I'll say, a very agile process during a time when we are all dealing with lots of Zoom glitches. So thanks to everybody involved.
Yeah, I think with that, we were interested in opening up the conversation to questions people might have about the results and anything we can sort of talk about moving forward with COVID-19 in the community.
So has everyone had an opportunity to look at the visual? Let's start there. So
I'm gonna drop it in there right now.
And maybe we should share the screen.
Can you share it?
Sure. So let me click on. Go back.
Hello.
Hi,
Hello.
Anthony.
How you doing?
Good. How are you?
All right. So I'm not late?
You are late.
Only if you think you're late.
Well, thought y'all be engaged in dialogue.
So this is the actual visual that we've been talking about. So if you go back to the email I sent without the time in it, my apologies for the meeting. This is the visual that you can click on. And Patrick, do you want to kind of show how if you hover over one of them,
Sure.
Yeah.
Yeah. So for example, here's a result from our study that indicated that 20% of Black respondents disagree or strongly disagree that their elected officials care about COVID-19 in their community. And that's sort of versus 14% of white and 8% of Latinx respondents. So we thought we should provide some context for understanding how that maybe relates to national trends. So you can actually click on this particular graphic and it'll take you to an article that shows signs of public trust in institutions amid the pandemic. Let me see if I can go back. Bear with me 1 second here. Is this where we were? Oh, sorry. I guess it's it's actually just a straight. Okay. Then it goes. And there's other graphics like that that allow you to get more information about results in Ypsilanti and how they compared to trends nationally.
And so I don't want to. I would be remiss if we didn't allow Elise to have some time with this. And so one of the exciting things is that our county has an equity office, and so we were able to work closely with Elise to kind of make this happen. And so Elise, do you want to kind of share from your perspective how this data and this research or needs assessment might be helpful to the county as we move forward and think about the work we do and grounded in equity?
Sure. Thank you for that, Marquand. I think that what is really striking about this information is how fresh it is in terms of real-time response. This is what our community experienced over the summer and subsequent to the initial first wave of COVID infection. And so as we're going into the fall, as we're preparing for potentially a second wave, as we're responding to concerns around education, opportunity, workforce development, and general access and support in our communities, this is really meant to be a tool that allows the folks who have been highly impacted in our community to give voice directly to our elected officials and institutional leadership about what their experience has been, so that as we're crafting our response, we're basing it on information that is direct from the community that isn't stale.
So I was asking Patrick to put the visual back up because I think that I presented briefly with some of my students, my social work students yesterday. We were just talking about it. And there's some that stand out a little bit more than others. And so, Patrick, if you could put the visual back up.
Oh, okay. I thought I had it up. My apologies. Yeah, so this I linked from the visual. Bear with me. I realize it takes a while to load, but was there one in particular, Marquand, you wanted to highlight?
Yeah, so I think there's a few, but one of the ones that I thought was interesting is 33% of Black respondents disagree or strongly disagree that an eventual COVID-19 vaccine will be safe and effective. So that's a conversation, and so I'm glad that we have public health. Jimena is on the line, and they have been helpful as we think about supporting residents. But to think that 33% of our respondents are vocalizing that they don't think that a vaccine will be safe. That's how do we gain that trust? I mean, because we understand that if for us to stand up a vaccine, but for 33% of respondents to say that they're not interested, that they don't trust the process, that's a conversation that we should start having now and building a relationship with the community and efforts to hear why it is that they don't trust wouldn't trust a vaccine or think that it would be effective. I think that was, everyone's thinking we're constantly hearing the news a vaccine should be available in the fall or the summer, but for a vaccine to be available, but the people who are disproportionately impacted to not feel it is safe or agree that it would be helpful, then I think there's a conversation that needs to be had there.
I agree, Marquand.
And so I think that is so that's the opportunity for us. Patrick, if you scroll down a little bit further, I think another thing that was interesting was the 19% of Black respondents report not having a checking account. Well, what do we know that who got the stimulus checks fast? Were the individuals who had a checking account attached to their tax return. And so is that an opportunity for us to work with financial institutions to say, hey, we know that there's a population that don't have checking accounts. And so it was a real opportunity for me to encourage a lot of my residents to open checking accounts. And so what we did here at FEP was we work with U of M Credit Union, but we also gave residents $10 to open their checking account. And we kind of ended up doing a secure checking account with residents so that some of our residents wouldn't be able to open a checking account or would have been on a probationary period because of their experiences in the past with financial institutions. But because we had a certain amount, FEP has a certain amount of money that we keep at the credit union, and we had everyone opt out. So meaning if the money's not in there, the card wouldn't go through. We were able to create a system. So now that our residents who want to have access to checking accounts can at the U of M Credit Union. So I think that was a low-hanging fruit, but it was an opportunity for us to make sure that resources that once they're allocated are being allocated to those who need them disproportionately in real time. So those are two that stood out to me as you look at this. If anyone else has anything that they would want to explore or talk through, it would be this is the space. And we invited a small subset of individuals who we thought were stakeholders that we wanted you to see the information before the press release or before it goes out to residents, so that we might be to think of some of the things as a team we could work through, or as an agency, or as an elected official to think through some systems that we could put in place to respond to what the data is showing us.
There's another point that I would love to highlight. The 57% of Black respondents not being able to meet a $400 unexpected expense versus 36% of white and 30% of Latinx respondents. As we are talking about secondary impacts of COVID and really looking at the long-term economic impacts, when we're having discussions around how folks manage to weather the storm or stabilize outside of poverty, the inability to meet that kind of unexpected expense without going into some kind of debt, be it a payday loan, or if they have access to a credit card, even though many of the African American respondents indicated that that was not something that they had access to. In terms of a planning perspective for our institutions and especially government entities, human service agencies, what we should be expecting in terms of impacts on our safety net systems is directly impacted by things like our community being unable to meet that kind of emergency expenditure.
Can I just say that I really appreciate that perspective. For those that don't know me, I work for, my name is Christopher Lemon. I work for the Ann Arbor Area Community Foundation. And why I'm really grateful for this data is that this will help to understand like what interventions are going to be needed moving forward, recognizing that the impact of COVID is going to be far beyond, when there is a vaccine. And so this really helps us to be open and aware to what interventions can look like both immediately and moving forward. So this is just a fantastic body of work. The illustrations also really help to kind of drive it home, as well as the links. So this is absolutely wonderful, and I'm very grateful for the efforts that have been put in place to make this available right now.
Thank you. And I think that, we were very intentional around some of the graphics that we picked. And so I think that, and it was a small debate around whether we would keep the tombstone or not, as it relates to the respondents who said they had lost a friend or family. And Elise was she was firm on the idea that she thought that really spoke to the urgency and the severity of this pandemic. And so she said, I don't think we should think of anything else. I think that visual really drives home that this pandemic is, impacting our families disproportionately, and that tombstone is a visual that drives that point home.
Especially when putting into the context immediately preceding that image is speaks to folks being unwilling to take a COVID vaccination. So even though we have a population that is being highly impacted personally, where they know people who are dying, the lack of faith in our systems is so substantial that they're unwilling at this time to accept a vaccine that could prevent that kind of death.
Yep.
Hi everyone. This is Jimena from the Health Department. Marquand, thanks for letting me join the meeting. I appreciate it. Charles was not available, but I just wanted to share that, Elise and I just had a conversation about the COVID-19 vaccine. And I think even before we get to a point of COVID-19 vaccine, we have an opportunity to kind of really think about our messaging as we look to promote flu vaccination. And we know that flu vaccination also is going to be so important as we head into the fall, and kind of obviously the concern about flu on top of COVID. I mean, one thing I would just highlight is that in general, we're seeing in terms of other data that we're seeing, there's in general across all populations, pretty significant resistance to the idea of taking a COVID-19 vaccine. Kaiser Family Foundation did a more national survey, and they found that 54% of the people that they surveyed would not get vaccinated. So clearly, I know we're talking about obviously Ypsilanti residents that were surveyed in this, but just to give a sense of the uphill battle in general we have about a COVID-19 vaccine, just wanted to give that context as well.
Thank you for that. I appreciate that. Is there... Is there data on the race of the 607 respondents? Yes, there is data on the 607 respondents. And Patrick, do we have that breakdown?
Yeah, I can let you know right now. It's so we of the 607 respondents who provided their racial identity, 33.4% were Black, 52% were white, about 11.6% were Latinx, and the remaining 3% were sort of an amalgam of all other racial categories. And that more or less mirrors the sort of racial characteristics of Ypsilanti in general.
We also have the economic information, demographic information as well. Is that correct?
We do, yes. In terms of household income. And we can actually, are people able to see my screen right now? Because I can just share, I can do, so about 20% of our Black respondents indicated they had income less than $10,000. And overall, roughly, well, I guess it would be, let's see, 16. Almost 80% of Black respondents had less than $40,000.
Mayor Lois, as you see this, is there anything that you're thinking as I see you looking at the data? What are you thinking? You're on mute.
Sorry. I was looking at the income ratio as he put it up there, and I'm just astonished, or maybe not astonished is not the right word, but that we have, he said, approximately 40% of Blacks under the 40,000. And as I look,
80%.
80%.
80%. Oh, okay, 80%. But yeah, 80% under 40. But then as I look down, that there's only about 5% that are making 75,000 or more. That just very vividly shows the economic disparity in this area.
I think that's also mirrored in the graphic here, where we know that 75% of our Black respondents rent their residence, as opposed to 39 and 41% of white and Latinx respondents, respectively. So that is the income disparities reflected in their housing situation as well.
Right. Yes, it is.
And I think that we all know that to live in Washtenaw County in particular right now, you know, it might be difficult for one to, you know, be able to maintain a household and a mortgage with less than $40,000 in income. I think it could be done, but I think we're even seeing on the south side of Ypsi, I think that the housing market has really started to boom and price some individuals out.
Yes.
And so when we think about, you know, one of the ways to acquire wealth is through, you know, owning your home and home ownership. And so by 75% of our respondents saying that they rent their place, there automatically is a narrative there that we shouldn't overlook. And I think the other thing that I thought was interesting was 48% of Black respondents think they are not eligible for the unemployment insurance benefit. And I thought that was interesting. So is there some work that we could be doing with Michigan Works and other entities, and to help residents understand that they were eligible? I mean, I know that we at FEP, we walked through the unemployment process with residents. And I think for a lot of our residents, as you guys know or may not know, when COVID first hit, it was very difficult to navigate the unemployment space in that system. And so I think some of our residents, I don't know if they thought they weren't eligible or they just kind of gave up on the process because they were having a hard time accessing the unemployment service system. And so I think that there definitely is an opportunity to do some education as it relates to who's eligible for unemployment and who's not. Because I find it hard to believe that we just look at the incomes and then to say that they're ineligible. I think that I find that really difficult to, especially for the $600 federal dollars, where you really didn't even have to give proof of income or proof of job. And so I think was that a missed opportunity for some of our residents. And that's just my perception, but we could, we could explore that further.
Marquand and Patrick, there's a question in the chat from Lynn. What can those of us in education who serve youth and families do to educate and support access to flu vaccines and ultimately a COVID vaccine? So if anyone on here wants to talk about using the education system and to kind of help with that communication.
So is Jimena still on the line?
Sorry, I just couldn't unmute myself fast enough there. So certainly we know that in general in Washtenaw County, while we have relatively higher rates of flu vaccination compared to other counties in Michigan, one of the age groups that actually doesn't tend to get vaccinated are kind of young adults. And so it would be particularly important to reinforce that the importance of flu vaccine with our older teenagers, young adults, but also we're going to be doing a lot to make vaccine clinics available, either provided by the health department specifically or by our partners at Michigan Medicine and St. Joe's, as well as some of our community clinics. So that information is going to be shared, via our health department website and social media. So the more that you can share that as well, the better. And of course, it's really, I think, important to focus on the messaging, really focusing on trusted community messengers who can help amplify the importance of flu vaccination and share information about how people can access the flu vaccine. And just as a reminder, flu vaccine is safe for anyone who's 6 months old or older. So it's really a vaccine that, in very few exceptions, almost everyone can take. And so it's also one vaccine, because what we're hearing from the COVID, the initial planning with the COVID-19 vaccine is that will likely be a series of 2 vaccinations. So at least with flu, it's just one vaccination.
Okay. And I think that another point that I just wanted to kind of, and it was no surprise to me, but the work from home question, the work from home measure, 38% of Black respondents report being able to work from home versus 65% of white respondents and 82% of Latinx respondents. So I think that really affirms the idea that, like, when we start to think about how kids engage virtually or they choose, we think it may be a choice, but in the event that parents aren't able to work from home and they may go to the grandparents' house who does not have Wi-Fi, how does that impact the child's education or what we ask of students? So, Lynn, as we think about the education space, we see that that our respondents, the majority of our respondents aren't able to work, because only 38% say they are able to work from home. So we had to think about the roles and the requirements or the expectations as we think about the children and transitioning to online learning. And I think that that's a privilege in itself that lots of the majority of us on this call probably have the option to work from home. And so, but the families that we serve, that's not their narrative. And so how do we continue to be mindful of that and continue to put supports in community for families where the kids have to be in a different space because parents have to go to work.
Marquand, this is Charles. I was able to join after all. I have a question based on the remarks that you just made. Do we know whether or not the 38% of Blacks who answered the survey didn't have the ability to work from home because their job didn't either allow it or it wasn't conducive to working at home based on the work that they do, or was it access to the technology needed to work from? So do we know? Do we have that information?
I can answer that. So unfortunately, we didn't ask respondents the type of work that they do, the kind of industry that they work in. So we're a little bit blind as far as why individuals can't work from home. I will say that the 38% of Black respondents who say they can't work from home is largely consistent with national trends pre-pandemic. There was a question, I was working on some work yesterday looking at this question, and around 35% of Black Americans were not able to telework, so to speak, prior to the pandemic. That was data collected by the Bureau of Labor Statistics. So what we observe here is largely consistent with what's observed nationally, and I think unfortunately, just to keep the survey relatively brief, we did not ask a whole series of economic characteristic questions of respondents.
Gotcha. Thanks.
And I think that another point that I don't think many of us will find surprising is 42% of Blacks and 33% of Latinx disagree or strongly disagree that they see the law enforcement as protecting people like them. So as opposed to 17% of whites. And so I don't think that is anything that's surprising, but I think sometimes we think in our utopian Washtenaw County that might not be the narrative. And so I think that I see your hand, Mayor. So you go ahead. You're muted still.
No, you go ahead. When we get finished with this, then come back to me.
Yeah, so I think that was, so I think that what we see is there's a distrust with the vaccine, and there is work to be done. So, and as we think around how do we engage, elected officials, public health, and the law enforcement, I think those are areas where we could enhance relationships. And so this was, I think this is a real opportunity for us to think about, is there some correlation there, or is it just by happenstance that overall our respondents are showing that there is some distrust with the vaccine and the process, and then their distrust for the police or law enforcement. That was it.
Okay. I just wanted to go back to the vaccine, and you touched on some of the things that I wanted to mention, was that there is a high level of distrust amongst Blacks for vaccines or for research studies. I've been on the IRB board at St. Joe now for probably close to 20 years, too long. But anyway, most of the research projects that we come through, that come through us, very few Blacks are in them. And many times, some of the research projects are not really aimed for Blacks. And so consequently, Blacks have this build up because of past experiences. I know with research, there's just this tremendous distrust. And I can't say that I have any answer other than I think the original question about vaccine had something to do with education. And I think it would take an intensive education campaign to get Blacks to really trust the vaccine. From my, experience on the IRB, I'm not going to jump up and down to be one of the first ones to take the vaccine. The way all the different things that we've been hearing, and possibly not just the way the research has been done, I would certainly want to wait and see, okay, is it really as viable as they say it is? I have a question also for Hamina. Now, is this going to, you said the vaccines that are coming out are pretty much two-step, that you have to have 2 shots. Once you finish the 2, is that supposed to be sustainable, or do you have to come back in a year and retake them?
Oh, I wish I knew the answer to that question. I think that remains to be determined in terms of they're finishing for most of the vaccine trials, they're in the kind of the last phase. And I think it's unclear kind of how long immunity or protection might last from those trials. And even with, I think it was the AstraZeneca trial, I don't know, you might have heard that they actually had to put a pause on that trial because somebody had some adverse reactions. And so, all of this, of course, makes everyone worried. And what we know is that there's just not a lot of, so obviously the trust in a vaccine is a huge issue. And I think that when you see something getting rushed so quickly, it's even harder, I think, to build that trust, because most vaccines are developed over years and years.
Right.
And so I think that also makes for a lot of hesitancy and concern about, will it be safe when it is even available to the public?
Thank you.
Well, I see that we had a participant ask for a copy of the survey. Patrick, is that something we could do? Could we send that out?
Sure. Yeah. I mean, a copy of the survey itself, or the results, or
the questions in particular.
Okay.
Yeah.
Yeah, we can make that available.
And so, Mr. Williamson and Dr. Malinoff, I'm going to put you two on the spot. And so 47% of Latinx and 30% of Black respondents report the lack of structure is the barrier to transition to virtual learning. And so Dr. Malinoff runs the Bright Futures After School program, and they have been doing some virtual things. And so I guess I wanted you to kind of chime in on that particular point as